I am on a mission to spread awareness and positive change, especially for older adults, whose health deserves more care and protection. As a specialist in senior care and chronic conditions, I have seen how diabetes quietly creeps into the body and begins its damage long before a diagnosis is made. Most people think diabetes starts with high blood sugar and ends with medications. But the real danger lies in what happens in the years leading up to that moment. This story is not just about blood sugar. It is about the silent signs your body may already be sending that you must not ignore. The truth is, many older adults miss these warning signs. Why? Because they are often subtle, painless, or easy to blame on aging. But make no mistake, these signs are red flags, and the earlier you spot them, the greater your chance of preventing serious complications like blindness, kidney failure, or amputation. Let's begin with the first silent sign. It is something that most people brush off as poor circulation or a cold floor. I am talking about persistent numbness or tingling in the feet or hands. This is not just a minor annoyance. It is often the earliest sign of diabetic neuropathy, a condition where high blood sugar begins to damage the peripheral nerves. It usually starts in the toes. Maybe you feel like your socks are bunched up, or there is a strange burning or crawling sensation at night. These signs are your body's whisper that nerve damage has already begun. If ignored, this can progress to balance problems, foot injuries that do not heal, and eventually loss of mobility or even limbs. The second sign often hides in your bathroom frequent urination, especially at night. You may think it is just part of aging or an overactive bladder. But if you find yourself waking up 2 or more times every night to urinate, it could be your kidneys working overtime to flush out excess glucose. This is a warning that your body is losing control of blood sugar regulation. Over time, this stress can wear out the kidneys and lead to chronic kidney disease, which is often irreversible by the time symptoms worsen. So why do these signs get ignored? Because they are not dramatic. They do not cause pain right away. They sneak in, they linger, and they allow diabetes to quietly take hold. But there is hope. Recognizing these signs now, before things get worse, can save your eyes, your kidneys, your nerves, and ultimately, your life. In the next section, I will reveal the third warning sign, the one that shocks most doctors, because it is often dismissed as something totally unrelated to blood sugar. But it is in fact a powerful predictor of diabetic complications. Stay with me. Let me tell you about a patient of mine named Richard. He was 67 years old, retired active, and thought he was in relatively good health. He did not have high blood sugar, or so he thought. But what brought him to my clinic was something unusual. Blurry vision that came and went. Not constant, not painful. Just occasionally foggy eyesight, especially after meals. His eye doctor said everything looked fine. But Richard's story made me pause. I asked for a blood test, and what we found was astonishing. His blood sugar levels were spiking after meals, and it was already affecting his eyes. This is the third silent sign. Sudden changes in vision. Most people think diabetes-related vision loss comes years after diagnosis, but in reality, blurred vision is often one of the very first signs that your blood sugar is fluctuating wildly. The lens of your eye changes shape depending on fluid balance, which is highly sensitive to glucose. You might notice your reading glasses no longer work as well, or that your eyesight seems sharper one day and blurry the next. These small shifts are your retina's early cry for help. Left unchecked, they can lead to diabetic retinopathy and eventual blindness. Now here is what shocks most people, including many physicians. These visual changes can occur long before your fasting blood sugar hits diabetic levels. In fact, post-meal sugar spikes, what we call postprandial glucose surges, are often the hidden culprit. They cause sudden fluid shifts in the lens, leading to temporary but concerning visual disturbances. Another critical sign is dry, itchy skin, especially on the legs, arms, or back. This is often written off as winter skin or just part of getting older. But in many cases, it signals early damage to blood vessels and nerves. Elevated blood sugar levels affect circulation and decrease the skin's ability to retain moisture. This dryness may also lead to poor wound healing, frequent skin infections, or unexplained rashes. At this point, many patients start connecting the dots. Numb feet, frequent urination, blurred vision, dry skin. They seem small, but together they paint a dangerous picture. They tell us the body is under stress and insulin is no longer working efficiently. In the next part, I will uncover the fourth sign, a symptom that is often mistaken for mood swings or aging, but in truth is one of the most important red flags of blood sugar imbalance. By now, you may be wondering, how could emotional health possibly be tied to diabetes? The answer is more than you think. The fourth silent sign is something many older adults blame on retirement blues, loneliness, or just getting older. It is sudden, unexplained irritability or fatigue. Not just tiredness after a long day, but a lingering sense of mental fog, emotional ups and downs, or even mild depression. Here is why it matters. The brain needs a steady supply of glucose to function. But when your blood sugar is bouncing up and down unpredictably, your brain struggles to keep up. This can lead to mood instability, poor concentration, and an overall sense of fatigue. Many patients describe it as just not feeling like myself anymore. Others say they snap more easily at loved ones or feel unusually sensitive to small frustrations. These are not just emotional quirks. They are biochemical warning signals that your body's glucose balance is failing. This symptom is especially dangerous because it affects your judgment, your motivation to exercise, your eating habits, everything. I have seen patients who started skipping walks or comfort eating, not because they were lazy, but because their mood was being hijacked by unstable blood sugar. Over time, this emotional erosion makes diabetes harder to detect, harder to manage, and much more likely to progress. Here is something else to consider. Many seniors with high blood sugar report trouble with memory, especially short-term recall. You might forget where you placed your keys or lose your train of thought more often. This is not just aging. Research has shown that chronically elevated blood glucose can damage the hippocampus, the part of the brain involved in memory formation. If you are struggling with brain fog, this could be a sign that diabetes is already affecting your brain function. Do not dismiss this. Your mood and memory are windows into how well your body is processing sugar. They are often the first to react when glucose goes off balance. And the good news: they are also the first to improve once blood sugar stabilizes. Patients frequently report clearer thinking and better moods just weeks after making dietary and lifestyle changes. In the next part, I will reveal the fifth silent sign. This one often shows up in your mouth, and what it reveals may surprise you. It could be the earliest clue your blood vessels are already under attack. The fifth silent sign of diabetes often starts in the mouth, yet it is one of the least recognized and most overlooked indicators. Many seniors report issues like dry mouth, bleeding gums, or persistent bad breath. These symptoms may seem like minor dental problems, but they are often early signs of something much deeper: systemic inflammation and impaired glucose regulation. Let's start with dry mouth. Saliva is essential not only for digestion, but also for controlling bacteria in the mouth. When blood sugar is high, the body tries to rid itself of excess glucose through fluids leading to dehydration. This includes reduced saliva production. The result is a dry, sticky feeling in the mouth, difficulty swallowing, and an increased risk of cavities. It is not just uncomfortable. It is a red flag that your body is losing fluid balance, one of the earliest effects of hyperglycemia. Next, let's talk about gum disease. Bleeding gum swelling, or tenderness are signs of gingivitis or periodontitis, inflammatory conditions that are far more common in people with undiagnosed or poorly controlled diabetes. Elevated glucose levels create an environment in which harmful bacteria thrive. Over time, this weakens gum tissue, leads to tooth loss, and allows bacteria to enter the bloodstream, contributing to systemic inflammation and vascular damage. This is not just about oral health. Gum disease is now recognized as a contributing factor to cardiovascular disease, kidney problems, and even cognitive decline. In many cases, it is the dentist, not the primary care doctor, who first raises the alarm. That is why routine dental visits are so important for older adults. The state of your gums may reveal what is happening in your arteries. These are the clues that help your doctor see the full picture and adjust your care before things get worse. You have more power than you think. Diabetes is not a death sentence. It is a call to action. And when you respond early, you protect your eyes, your heart, your kidneys, your independence, and your future. If this video has helped you, please consider subscribing, leaving a comment, or sharing it with someone you care about. Together we can prevent suffering and spread hope.